Good evening. Thank you for watching. This is our current affairs update in English. I'm Leah Hogg. Our topic this evening is COVID-19 at your request. As the figures rise, you're obviously very interested to know more about what's happening. At the end of this program, we'll have a short briefing in Maltese. My guests here in the studio are Dr. Chris Barbara, who's the chairman of the pathology department, family physician, Dr. Christopher Deguara, and psychiatrist, Dr. Joe Cassar. And I thank you very much for joining us. Thank you. Thank you. There's been a lot of, obviously, an increase this week. Perhaps I can start with you, Dr. Barbara, to just give a general update of the rising figures that we're seeing.
Exactly. I think in Europe we're seeing lots of rising figures. Maybe in Malta we've seen these figures just a bit before the other countries. And not only the number of cases which are rising, but also the number of deaths as well. Unfortunately, we've seen quite a few in the last few weeks. And this is because it all started with the younger generation, and the younger generation were infected, but they go back home, they infect their parents and also their grandparents as well. And of course, we all know that the comorbidity affects a lot, so people who are vulnerable get much more complications, and the mortality is so much higher in people with comorbidity. And this is exactly what we have been seeing. So unfortunately, it's not only that we have the number of cases going up, but that the number of deaths have gone up as well. We also see a different age group of people who are being infected now, because although we've seen a few homes for the elderly getting infected, we are now getting increased hospital admissions, and we are seeing also younger age groups being admitted to hospital. And this is because we have a larger number of cases. So when you get larger numbers, you get younger people being admitted to hospital again.
So when you're talking about this new age group that you're seeing, can we identify that age group?
Yes, we're seeing 30-year-olds, 40-year-olds, whilst before we were seeing hospital admissions in the 60s, 70s, 80s, and even 90s. Today we have people in hospital and unfortunately also in ITU who are in their 30s as well. So this is very important. This is the message I would like to pass on, that people have to be vigilant all the time. I think we are ad nauseum now, hearing all the mitigation measures which we personally have to take. Unfortunately, a lot of people are saying, listen, it doesn't matter, we'll soon get the vaccine, it will all be over. No, I think the first thing which prevents this infection is trying to socially distance ourselves. That's why we're all good friends, but we're sitting apart from each other today. Just because we want to give an example that this is the mitigation we want to. We're also wearing the masks, because we know that the masks are protecting those droplets from infecting others. So Chris is protecting me and Joe, and I am protecting them at the same time. We washed our hands, we use the sanitizers, we don't touch our faces. If everyone does this, and unfortunately when I go around in the streets, this is not what I am seeing. I am seeing a lot of people sharing glasses, bottles, and so on. And this is the opportunity which the virus takes to infect people.
Sure.
And this is the result. So we're seeing these numbers, these increased hospital admissions, this increased mortality.
You mentioned the distance that you three guests have between you. We've seen, and people have commented about it, photos in the media where public figures are wearing masks but are sitting very closely together. What are your views about that?
Social distancing is one of the most important things. So ideally everyone should be. Now, if we're wearing a mask, we can be closer to each other. But ideally, at first we used to say 1 meter, today we're saying 2 meters is the best distance. I think you mentioned updates as well today, and while before we said it is only droplet infection, today there is some evidence that it is airborne as well. So unfortunately, we're still discovering. Now, these are a few scientific papers which I'm all the time reading. So it could be that the virus can linger in the air for longer than we think. So
Do
it's
we know how
important.
long that would be?
It depends on the surface. So it could be a plastic, it could be paper, it could be metal, but it could be quite a number of hours.
So we're going back to the first thoughts that people had right at the very beginning of
Exactly.
COVID-19. Dr. Deguara, as we approach the winter and we see more flu, can we perhaps update our viewers on your views on the influenza jabs?
Right now we're going into the influenza season, and obviously that is going to be quite a battle to distinguish people who are ill, whether they are suffering from influenza or whether they are suffering from COVID. We know that they are very similar in symptoms, so it's going to be difficult for doctors to differentiate from those. Also, now that school started, so there's something that we also have to work into it, because you will get people who are closer to each other, so the viruses will be spreading even more. This year, more than previous years, we are always telling people to get vaccinated against the influenza vaccine. Why? Because at least if you are vaccinated, you are covered for at least the 4 strains of the commonest influenzas. In fact, most private doctors have sent out lists to government so that he will supply with the vaccines, which hopefully he will dispense in the coming weeks, and we can start vaccinating. We are also finding some resistance. Well, I think we always found, where people tell us, but listen, I do not want to take the jab because whenever I took it, I got worse or I got ill. We are obliged to tell them that, listen, the vaccine is an inactivated form, so you cannot get ill with the vaccine. The only thing that you can get is not the influenza with the vaccine. So it is important that young kids and people who are suffering from comorbidities, as Dr. Barbara was rightly saying, we have to protect those first and foremost. The rest would be ideal to be vaccinated, but then at the end of the day, you cannot force anyone to vaccinate himself. You can show them the evidence, and then it's up to them.
So in your opinion, as many people as possible should get the vaccine for influenza?
Yes.
Thank you. Dr. Cassar, thank you for coming. Mental health issues, they're probably on the increase too, since the duration of all these restrictions is now quite prolonged. How can we advise our viewers into keeping well with regards to mental health?
Yes, I mean, mental health issues have been on the increase since the very beginning of COVID. And mental health issues usually are on the increase every time you put into the factor the unknown. When unknown becomes a major factor, and with COVID-19, as Dr. Barbara was saying, at times we talk about airborne, at times we talk about droplets. When you put that in as a factor, that in itself starts off a whole process in the brain, which in itself is defensive, because it starts off what we call fear. But fear will start off a process of anxiety. And as we know, anxiety, which is already in around 20% of the population as a norm, obviously if it increases in those 20%, and over and above that, it also increases in the other 80% as a fear factor, that itself will start off a cycle of events that it's not just about anxiety. In fact, we do see a number of anxieties resulting from COVID, but we also see a number of other comorbidities in psychiatry which are related to this fear factor. For example, the amount of alcohol that is being consumed worldwide has increased drastically since the beginning of COVID. And we have people who had been off the booze for 20 years who have started off on the habit again. It's unfortunate, but this is a reality. I work in Mater Dei Hospital as a consult liaison psychiatrist, so I see a lot of patients who come into the hospital, and a lot of them are coming in with a lot of alcohol comorbidities, because alcohol itself has a lot of other problems. The amount of anxiety is also precipitating other illnesses that, for example, were quiet. For example, someone who was psychotic because of a trauma 25 years ago, again, with the severe stress, the severe stress itself starts off a process that can get the person to re-experience those psychotic symptoms. So we are getting these patients that had been stable for years on end, and yet, they're coming in with a relapse of psychosis, with a relapse of severe depression. Obviously, telling people don't be afraid is an understatement, because how can you not be afraid of the unknown? Everyone is afraid of the unknown. So we have to at least be cognizant of the fact that the unknown instills fear in everyone, including me. I tell them, even I am fearful of the unknown.
There's also the problem of an economic crisis in some families too.
Well, there is a problem of economic crisis, and some families actually struggle with this, because on one hand, they don't want to close down, lock down, etc., etc. On the other hand, they also want to protect the elderly, their parents. So, it becomes a bit of a quandrum in itself. But, so we have to tell patients, listen, fear is something we have to deal with. And there are these things that we have to do to help us, overcome fear. Telling someone, don't be afraid, is not going to do it. I always give the example of someone, for example, who's afraid of mice. It's useless telling someone who's afraid of mice, don't be afraid, because that person, if that person sees a mouse, he's going to be afraid. So telling them don't be afraid is not helping them. Actually, it actually increases more their anxiety. What we should do is, first of all, be cognizant that there is a fear factor, and two, give tips of how to overcome it. And there are a number of things we have to do. For example, healthy living. We often talk about it, we think it's nothing, but it's a lot. So, what we eat is extremely important. Exercise is extremely important. Exercise in itself increases the endorphins in the brain. Endorphins, well known as the happy hormones, are actually important to have in these moments. So exercise, besides helping someone get healthy physically, also helps people to get healthy psychologically because of the endorphins. So exercise, healthy eating, and then also being able to learn how to live moment by moment and relax, in a sense that we have to be careful. I always tell patients, I was actually a COVID patient, a COVID positive patient. And I can assure you that it's not easy. The fear factor is not easy. And I always say that my experience as an asymptomatic carrier, I could say I was asymptomatic 15 days after I tested negative. Because until you test negative, you wait day by day. What new symptoms could happen today? So, in itself, you have to be careful. One thing I always tell patients and I always tell people is, be careful what to read, when to read it, and how to interpret it.
So always to go to the good source of information.
I would say one good source and stick to it. I have to be...
And I mean, a good source of information is the Ministry of Health guidelines.
Well, not just Malta.
Yes, and
WHO is a good source
and quite
of
a
health.
lot of good international journals.
But going on social media and reading all sorts of experiences and all sorts of videos that come on the social media is daunting and can be very damaging.
Sure, sure.
The other thing that we need to do is also to make sure that every day we balance it. So we have to have time, not just to hear about COVID, but to do hobbies, to read, to play games with the family, to see a nice movie. We don't need to stay on the social media. There are people who, even whilst, watching a football game, have to look at what's happening on the social media.
Unfortunately,
to get updates on COVID. I mean, I'm sorry, but, like that, it's going to be extremely impossible to actually say to someone, relax. How can you relax?
Absolutely. Ask the experts. We've got a short clip. A couple of weeks ago, we spoke to two specialists during this program from the UK. One of them is a child health specialist and speaks about children going back to school and the risks. And the other one is an emergency consultant. So we're just going to see what they have to say and then get back to our doctors here.
We have identified age as being a risk group, which is well recognised, but also some people of South Asian ethnicity are particular high risk as well. Children, fortunately, are very rarely affected, and this has been a blessing.
Can we discuss children and their return to school? What are your views about that?
I'm quite satisfied that children are not at high risk in themselves, and I'm very happy for my daughter to go back to school and for other people's children to go back to school. The risk in schools is between teacher to teacher and teacher to administrative staff and occasionally teacher to child. But in the data we have seen from the United Kingdom, it is relatively uncommon for children to transmit to adults. And this is because symptomatic disease in children is rare. It takes some energy to lift the virus from the mouth into the air and to project it to an adult. So because children are mostly well and not coughing and not sneezing, they're not on the whole spreading the virus in the same way that adults in the early stages of disease are spreading it. So I'm happy for the children to go back to school. I think we also realise, however, that the university return is a mass migration, and that inevitably will lead to increasing cases in this next couple of weeks.
Well, it really has, and it's been fantastic. And of course, with that volume of research has occasionally come a reduction in the quality of the research, but we've learned some really important lessons about COVID-19, about its epidemiology, about therapeutic strategies. And that now needs to be applied across the infectious disease landscape. We need not only research on therapeutics and what's effective, we need research into systems design, a system that is well engineered to respond well to normal infections, will respond well to a pandemic, as well as we need better data. We need data that doesn't just focus on a few pathogens. We need data that focuses on a broad range of infectious agents, but also around the body's response and the recovery from infectious disease.
Thank you for watching. Dr. Barbara, what are your views with regards to children and going to school?
Yes, I couldn't agree more with this consultant here. We all know that the receptor for the COVID-19 virus are the ACE2 inhibitors, and it is more difficult for these viruses to attach to receptors in children. So when we see children who are infected, these are relatively asymptomatic, as Joe was, so they are transmitting the virus less because the virus load is much less as well. But once again, at schools, we have to be careful because there are adults in schools who can transmit this amongst themselves. On the contrary, it could be the adult who is transmitting the infection to the child. But also at university, where there are older students, we have to be careful as well. And there we have to practice the mitigation. And I'm sure the mitigation measures should be practiced at the university as well, because of the possible transmission from one person to the other. So these are very important things. They also mentioned, the second consultant mentioned about the different therapeutics which are now available. They are still on trials, I'm afraid, so there is nothing which is so definite. But we've seen antivirals like the remdesivir, for example. We've seen the use of BCG as a vaccine which some people feel could be useful. We've also mentioned vitamin D. You mentioned the diet as well, which is so, and they found that the mortality is higher in populations where the vitamin D levels are low. Whether this is correct or not, we're not sure. The numbers are still not high, but this is the research which is going at the moment. Just recently, we read articles that the linoleic acid, for example, is so important because the virus has spikes jutting out of the virus, and this acid can attach to the spike and block it from attaching to the receptor as well. And this is part of our nutrition, our eating of unsaturated fats and so on, which could be as well healthy, protecting us against getting this infection. So these are all recent researches which are helping us to try to overcome this infection. One recent one, which is being practiced in many countries, and they're finding this to be so useful in severe disease, is the use of a very common drug, which is dexamethasone, 4 milligrams. They all say that when it's a severe disease, it works wonderfully. So there is a cytokine storm. There is like a storm happening within our body when the virus interacts with the receptor and causes this infection, and this calms down the storm.
Thank you very much. Thank you. That was our short briefing in English. I thank you for watching. We'll be with you again on Thursday next week. In a few seconds, we'll have a short briefing in Maltese. And I am with Dr. Chris Barbara, Dr. Joe Cassar, and Dr. Chris Deguara. Thank you very much and good evening. Nirringrazzjakom li għedin maħna intom saqsejtu li tixtiequ aġġornament bil-Malti waqt dan il-programm u illum santukom aġġornament malajr minant il-mistednin tagħna. Nibda b'Dr. Chris Barbara, jekk jogħġbok.
Naħseb importanti li niftakru illi qegħdin fit-tieni mawġa ta' din il-pandemija, in-numri donnom tilajn, konna qegħdin nitkellmu fil-bidu illi we are trying to flatten the curve, ġifieri dik il-grafika qegħdin nippruvaw imbaxxuha, però jew għax in-nies iddejqu xebaw u naħseb Dr. Cassar semmilna l-effetti psikjatriċi u issa jgħidilna wkoll, però b'xi mod fejn qabel konna mmorru nixtru u nżommu shopping għalih, innaħħu żarbun qabel nidħlu d-dar noqogħdu kulħadd il-bot minn xulxin, ishom ċerti affarijiet qegħdin jintesew u n-numri reġgħu qegħdin tilajn. U mhux in-numri biss qegħdin tilajn, imma qed naraw iktar admissions ġewwa l-isptar, iktar nies li qegħdin jidħlu l-ITU u sfortunatament bdieqa ngħid illi anke mortalità qegħdin naraw iktar u iktar. U għalhekk jiena narġa' nħeġġeġ il-kulħadd illi l-iktar affarijiet importanti f'dal każ mhux nibqgħu nistennew u nittamaw li jkollna t-tilqima malaj kemm jista' jkun li jiena naqbel li kieku dinha tasal, imma illi nibqgħu nieħdu ħsieb il-mitigazzjoni li jiena intambru fuqha naħseb kulħadd iddejjaq jisma', imma daw kif qed taraw qegħdin aħna l-bogħod minn xulxin qed inżommu l-metri l-bogħod minn xulxin, qegħdin libsin il-maskra, kollha minna sanitizer qabel tħanna, maħniex inmissu wiċċna, u bekk allura aħna għandna nistgħu nikkonsidraw li mhux se taqbad COVID jekk xi ħadd minna jkun infettat.
Jiġifieri l-affarijiet sempliċi ma nistgħux ninsewhom.
Ma ninsewx ninsewhom qatt. Naħseb dik hija wieħda mill-iktar affarijiet kardinali f'din l-infezzjoni.
Grazzi. Dr. Cassar, nistgħu nitkellmu biex nagħtu aġġornament fuq id-diskors li għamilt illum.
Jiena għadt li fid-dinja kollha il-problemi ta' saħħa mentali qed jiżdiedu, bdew jiżdiedu mill-bidu net tal-COVID-19. Qed naraw illi l-ansjetà illi diġà hija għolja fil-popolazzjoni għax 20% tal-popolazzjoni tbati mill-ansjetà żdiedet sostanzjalment u dan għaliex ovvjament hemm il-biża'. Inti meta inti hemm xi ħaġa li ma tafx x'inhi, ma tafx se jiġri, ma tafx xejn fuqha, toħloq element ta' biża' illi huwa normali. Hawnhekk irid ngħid illi meta inti tibża' minn xi ħaġa li ma tafx x'inhi, hija normali li tirreaktja billi tgħid qed nibża' mhix ħaġa ta' barra minn hawn. Issa, l-importanti hija kif tiddilja ma' dik il-biża'. Issa, il-problema edha tkun illi ħafna nies pereżempju żiedu l-ammont ta' alkohol illi żdied sostanzjalment fid-dinja kollha u nies li kienu ilhom ħafna ma jixorbu reġgħu bdew jixorbu, addirittura kien hemm nies li qatt ma xorbu illi waqt li kienu fil-lockdown jgħidulek bdew jixorbu pereżempju. Jiġifieri importanti li nifhmu li l-alkohol fih innifsu għalkemm fil-bidu net meta tieħu grokk jew meta tieħu drink tgħinek biex tissetilja wara ċertu żmien l-alkohol jipproduċi ħafna problemi fosthom id-depressjoni pereżempju. L-alkohol huwa magħruf bħala qisek qed tieħu mediċina biex taqbdek id-depression. Importanti.
Qed jgħiduli li qed nixtieq li Dr. Deguara tabib Deguara biex nagħlqu ftit tal-lum. Għax ma baqgħniex ħin.
Leja, biex nagħlaq u biex ma ntawwalx naħseb importanti nifhmu li ma rridux nillaxkaw. Naħseb il-ballun huwa f'saqaj kull wieħed waħda minnha u jekk nieħdu ħsieb affarijiet li huma sempliċi kif semma l-kollega Joe u anki Chris fejn inti jekk jista' jkun toqgħod il-bot tagħmel distanza soċjali, tilbes il-maskra, taħsel idejk, dawn huma l-iktar affarijiet komuni li wieħed jista' jagħmel. Inutli noqogħdu nistennew jew il-vaċċin jew nistennew il-gvernijiet jagħmlu xi ħaġa, naħseb li kull wieħed waħda minna jista' jiġbed l-istess ħabel niġġieldu di l-problema li qegħdin ngħixu fiha b'affarijiet li huma sempliċi. Jiġifieri dawn l-affarijiet huma żgur li qegħdin juru li naqsu l-mart. Allura huwa importanti. Qedna wkoll dwar l-influenza li sta żmien l-influenza u kemm huwa importanti li n-nies jitlaqalmu, speċjalment dawk it-tfal iż-żgħar u dawk li huma vulnerabbli.
Nirringrazzjakom li ġejtu llum, nirringrazzjakom li qed tissegwuna mid-djarkom hawnhekk hija xandira diretta minn Net Television miegħi għandi lil Dr. Chris Barbara, Dr. Chris Deguara u Dr. Joe Cassar. Nixtieqilkom il-lejl it-tajjeb.